We know that you can explain your thesis in 3 minutes. Can you do it in 30 seconds?
Well, I'll give it a go. So my research is looking at what people with lived experience of disability, so that includes children with disability, young people with disability, adults and their families as well. So looking at what they want from research and future like translation activities like sport programs in order to improve their sport participation. And we're also looking at how we can use the insights that people with disability have shared to inform future research projects, policies and sport programs to hopefully make sport more inclusive in Australia.
So my PhD looks at how antibiotics and their transformation products can contribute to antimicrobial resistance in wastewater. And this matters because even small amount of these chemicals can help bacteria resist and survive. And I'm hoping that my research can help in monitoring and also mitigating AMR in the environment.
So I'm designing and developing a scaffold using 3D printing technology just to thicken gum tissue around teeth and dental implants. And I'm also making sure that this scaffold is safe, reliable, and ready for clinical use. Because right now, rebuilding gums means taking a tissue from other part of patient's mouth, so it's more painful. I hope this scaffold makes treatment much easier and gentler for the patients.
I'm building a reference map of pediatric immune system from infancy through adolescence because currently we have no idea of how pediatric immune system is growing, and a lot of research was only done on adults. And I hope my reference will give the doctors signs about how to detect the early signs of disease and develop much safer treatment for our kids.
Okay, so my research is to identify the relationship between sleep and pain after motor vehicle crash injuries. So this research is important because chronic pain is a significant burden in this population, but we don't know what is an effective early treatment. So understanding the relationship between sleep and pain in the early stage may help us identify whether sleep could be a possible target for early intervention treatment. Yeah.
So my thesis is looking at translating a personalised risk score for age-related vision loss into practice. So the reason I'm doing this is because on average it takes around 8 years for a test or a medical intervention to actually make it into practice. And so obviously you can't reap the benefits until you work with clinicians to figure out how they can actually use this technology and why should they basically, and educate them in that way.
Yeah, so my research looks at how we can harness our gut microbiome to target specific signaling pathways seen in a disease called PSC. And I guess what I hope to get out of this research is to find bacterial metabolites that can target a specific receptor that's recognized in the disease, in the hope to find a novel therapeutic and improve disease outcomes.
Brilliant, thank you.